Hi, everybody. My name is Mila, and I'm here to present ADHD. What's OT got to do with that? This is, I think, my third webinar with Therapro, and this particular topic is very close to my heart. I would say, 3 years ago, my daughter was diagnosed with ADHD, and it took me on a real intense quest of what I, as a therapist, as an OT, can really do to help her. And I have realized at that point that we as therapists I typically, as OTs, are overlooked resource, and I am taking today as a time and as an opportunity to bring more light as to what it is that we can do to support an ever-growing population of ADHDers we are encountering in clinics, homes, obviously schools, and just cousins, nephews, family members. I think this has become such a common diagnosis that it's hard to ignore it. So what are my objectives for today? It's to give you a little bit more of understanding of brain science behind ADHD. Those of you who know me or heard me know that I am a big fan of neuroscience and neurobiology. So I tend to look at foundational skills through neurolens. All right. The other part of it is, again, like I said, I think as OTs, we need to be a little bit more aware and understand exactly how we can support this population. And one thing that I find that is really was very startling to me through the process of dealing with my own kid is that there's a lot of disconnect between teachers, parents, and clinicians when it comes to this diagnosis. And it was very interesting to see the amount of misunderstanding and misconceptions and almost some stigma associated with that and lack of communication. So I think the importance of collaboration and real clarity amongst all the team members is really important. Okay, so a little bit about me. I have been a therapist, I think at this point, for most of my life. I 23 years of experience. I worked in schools. I worked in home settings. I worked in clinics. Currently, I have a clinic. I'm the owner of KidLink Therapy here in Massachusetts. In addition to that, I just recently opened up a nonprofit here called TheraYouth. Our previous presenter, Arina Markov, touched on that organization as well, and I have the privilege of bringing this to this state. It originally started in New Jersey, and it supports kids with all families, regardless of their socioeconomic status. One of the things that I found as a founder of KidLink Therapy is that it's hard to give everybody the care that they need because of restrictions provided by insurances and private pay is hard for people. So this TheraYouth gives everybody an opportunity to receive services. So I'm feel very lucky to be a part of that. As for me, my main thing about therapy is that it has to be fun, it has to be effective, and it has to be collaborative. So this is how I run KidLink, and this is how I run anywhere that I work. That's the approach to care. Okay. So what is ADHD? ADHD, according to DSM-5, is Attention Deficit Hyperactivity Disorder, and it is defined as a neurodevelopmental disorder characterized by a persistent pattern of inattention and hyperactivity or hyperactivity that interferes with functioning or development. Okay, so that's a really great day, really, really great overview of ADHD. However, it's not really all that functional. When we're looking at ADHD, it's really a disorder of self-regulation and executive function. And we as OTs know that this is what we went to school for. We went to school to focus on, especially when we focus on peds, it's really about self-regulation, and a lot of it is about executive functions. Of course, there's a lot of other areas, but we are experts. We did go to school for this. Okay, and a lot of times we are not part of the teams that deal with ADHD, and we're not part of the, we're not part of the specialists that get involved in their care. So we become an overlooked and underutilized resource a lot of times. But really, our contributions are pretty vital because we can enhance functions, we can increase independence, and generally really enhance the quality of life as well, not just of the kids, but also their parents, the teachers around them, because the things that we can provide and our unique creativity and approach to how we treat kids with ADHD can be very different than the typically prescribed model. Okay, so how many of you have seen ADHD kids that are very, very focused? When kids with ADHD really are interested in something, when they really want to do something, this isn't about inattention. They become so hyper focused on something that it becomes like that it's hard to disengage them from it. Not just it's not, and you get like parents come in and they wonder, like, but when they play Legos or when they draw, when they do something they really enjoy, they're not inattentive. So ADHD is not just about attention. Okay, it's really about performance and execution. It's not always about just an attention. Yes, an attention component is definitely there, especially when it comes to understanding boring stuff. If a child with ADHD is not interested in a material, their attention is very, very fleeting. However, if they are motivated and involved in a task, then their attention is actually quite intense. And it's the opposite. It's hard for them to transition out of those tasks, not get involved in them. Okay. There's obviously neurological basis for ADHD, though a lot of times we hear that it's really just about behaviors, that it's if a child is not behaving well, if they are impulsive, if they're dysregulated, they kind of get marked by their behavioral kind of presentation rather than understanding the neurological basis and the brain structure, as well as the neurotransmitters that are under underproduced in their neurological system. So one interesting thing about ADHD is that girls are very much underdiagnosed, and that is because their presentation is different. Girls do tend to be quieter. They're not quote unquote behavioral, so they're not typically hyperactive. But what they do is they sit in a corner and they space out and they doodle and they do things and that are quiet, but and not obvious necessarily to the teachers or to the providers, but then when you ask them information, they may miss stuff, or they may not recall information that was shared with them. Their working memory is impacted, as well as their ability to attend to instruction at times is also impacted. But because they don't demonstrate as many behavioral kind of episodes of running around the classroom, or maybe being overly silly, or maybe touching inappropriately, or being very impulsive, they're often kind of viewed as, oh, it's okay, she's just busy, or she's all right, she's getting the material, she's understanding things, but she's just in her own world. So, and then as a result of that, as the girls kind of grow up, they have gaps in knowledge, and also their self-esteem is suffering. So, pay attention, not just behaviors in terms of what observable behaviors, but little more subtle behaviors as well, especially in our female students. So, ADHD is a disorder of performance and not learning. What that means is that it's the output that kids struggle with, not the ability to take in information. The ability to take in information is typically quite well developed. They're able to learn, they're able to understand things, they're able to do things in terms of understanding what the teacher may want from them, but they really have a hard time with output. So they may have very bright minds. They can be very curious. They are very innovative. They're outside the box thinkers. A lot of entrepreneurs and athletes have ADHD. Michael Phelps, Simone Biles. There's several entrepreneurs that have it as well, but that are fairly famous. Richard Branson, I think, is one of them. The guy who did the Virgin Airlines has it and notoriously talks about it. So this means that these kids are not necessarily, going to be failures in life. That doesn't work like that. But what it does mean is that they need certain supports and they need certain accommodations and people that understand them and understand their strength and understand their challenges. What they do struggle with is execution, so the output, right? So they struggle with completing assignments. They struggle primarily with the executive function skills, so time management, working memory, self-regulation, emotional control when they're younger. So these are the type of things that they have more challenges with, especially when the tasks are daily and boring in their opinion. So routines are very hard to follow. Things such as, getting up in the morning and following a morning routine can be really, really challenging. Also, skill expression. So them demonstrating what it is that they can actually do can be really, really hard because they are distracted. In their heads, they can be thinking 1,000 thoughts, right? But then you ask them to write an essay on just one topic, and it takes so long to just pull out information, pull that information out and sequence it and organize it and place it on paper, or even verbally, because there's so many things that are going on inside their heads that it's very hard to condense that and put that into a format that is expected and accepted by the teachers or by even parents, like folding clothing. If you're like a parent, right? Like, so you're doing laundry and you have your child you want them to fold some clothing. That can be, it's not that they can't do it. It's that the amount of time it takes them and the amount of how distracted they are in the process of completing that task. That's really what's hindering them. Is there any questions on that? Okay. So what are the common myths about ADHD? So ADHD has a strong genetic component. It's not caused by bad parenting. It's not caused by screen time. It does have a genetic component involved in it, but a lot of times I see parents coming in and they're very sad that is for whatever reason they're the cause of their children's struggles. And it's not that their parenting skills are impacted or that the child is overwhelmed by screen time or video games. Those things can exacerbate some of the symptomology, but it's not the cause of them. ADHD kids are not I don't know, no kid wakes up in the morning thinking about how they can upset their parents today or piss off their teachers. It's really not how any kids typically work, right? You know, they're not lazy, they're not defiant, and they're not unmotivated. It's just really hard for them to do certain things. They're just not wired the same way as we wired, so things are harder for them. And it's not because they're behavioral, and it's not because they're trying to make anyone upset. Okay, it is a neurobiological condition, and there's changes and differences in brain structure and function when it comes to how their brain is formed, and what goes on with them neurologically. Okay, so ADHD brains are typically 3 years behind their neurotypical brain. So what does that mean? That means that there's certain parts of the brain, like the frontal cortex and the cerebellum, okay, and basal ganglia, that are younger than than their developmental age. So a child who is going to be about 10 years of age may act at certain areas when it comes to executive function, self-regulation, maybe some working memory, things of that sort. It's not about learning. I'm just going to remind you that this isn't about learning. It's about output, right? And presentation. But they're going to be acting a lot more like a 7-year-old than they are like they're a 10-year-old, because their brain is younger and structured differently. Okay, so when we are talking to these kids and we're giving them activities and demands and expectations like we would from a 10-year-old, they can't match that up. They can't do it. And it's not because they don't want to. They want to. It's just because their brain is not wired the same way. So it's so much harder for them. Even though they look bigger, they look like they could do it. It's just, what we see versus what they can do is not the same. They do have reduced activity in the prefrontal cortex. So that's where that executive function lives, right? And this is really impacting their ability to complete those high level skills, right? So for example, impulsivity and emotional control is one of the younger executive function skills, but our ADHD kids really struggle with that. This is where we see a lot of challenges with impulse control, and sometimes they are touching people and when they shouldn't be touching, and they're walking around when the teacher is telling them to sit still, and it's not because they want to upset you, it's because they struggle with that inhibition aspect. So one thing that I want to point out, and that doesn't get discussed very frequently, is oculomotor skills for our ADHD kids. So that if you were ever in a classroom, or you see kids with ADHD, what I notice a lot and what I started kind of researching is that their head is always moving. Their body is always moving in a chair. So I started wondering about, well, what are their oculomotor skills are doing? Why are they not using their eyes? And what's happening is that they're typically not dissociating. So they're not dissociating their eye movements from their head movements. So they're moving their head a ton, and they're looking around, and they look wiggly all the time because they're not really accessing their periphery very well. They're not using their eyes to scan their environment. They're using their entire body and also like head movement to do the tasks that their eyes should be doing with much more ease. Okay, so when you do have kids in your practice that do have this diagnosis, please check their oculomotor skills, because they're really important, not just for accessing periphery, but also for visual focus. So like convergence skills are very important. That because you need to go convergence, divergence for near point copying and distant point copying skills, as well as reading. So, and as long as these oculomotor skills are not assessed and not looked upon, we can't really tell, whether this is an area that we need to work on. Okay, but one thing that we all know is that neuroplasticity is is high, and we can always change and make changes in our brain through targeted interventions and through the right tools and right exposure. So this is always the silver lining. Okay. So the neurology of ADHD is that there is the prefrontal cortex, and the CEO of the brain, right? That's where we are making a decision. That's the organization, that's impulse control, that's all the things that I just talked about, right? Like, this is what makes us do complex tasks that have multi-step directions, tasks that are can be difficult to do on a moment, that require inhibition as well as patience, right? So for example, I don't know how many of you guys heard of the marshmallow test. It's, if you put a marshmallow in front of a child, are they going to grab that marshmallow and eat it right away, or are they going to wait 10 minutes if they know that the person is going to have them eat 2 or 3 marshmallows if they wait this long? So that's the essence, that like at the very baseline, that's the inhibition, that's your executive function. Then we have our cerebellum. And that's, we know the cerebellum, and it's primarily responsible for balance, coordination. It has sensory processing. Vestibular system is a hub over there as well, all the nuclei. It's also responsible for social emotional behavior. It has a lot of neural pathways to the frontal cortex. And it also has 20% of neuronal activity is done in our cerebellum. But what happens with kids with ADHD, that cerebellum is frequently underdeveloped and is smaller compared to their neurotypical peers. So what happens with that is that we look at these kids, and they can be clumsier. They can have difficulties with mid-range control. They have trouble with rhythm and timing, coordinated movement, complex movements, things of that sort, because of this particular neurological change in their neurology. Then we have basal ganglia, and basal ganglia is about controlling movement, but it's also about developing routines and memory, right? So this is where a lot of dopamine is made as well. So dopamine is one of the main neurotransmitters that's really impacted in kids with ADHD. So dopamine is a motivation and reward centered neurotransmitter, and it plays a role in regulating attention and behavior. And brains with ADHD don't often have enough dopamine production, and that impacts their ability to attend. That impacts their ability for impulse control. Also, they're constantly seeking how to raise that dopamine. So there's a lot of movement that goes on, and there's a lot of switching tasks, and they love novelty. Kids with ADHD really enjoy novel things. So one thing that they try to do is they try to find ways to increase that dopamine production naturally if they don't have any supplementation for that. Exercise is actually one of the best ways to increase dopamine. So anything that you can get your children to do in terms of movement is going to benefit them. So even if it's structured movement or even unstructured movement, increases dopamine production. So going for runs, spending time on playgrounds, giving them cardiovascular kind of activities, dancing, whether it's structured dancing, unstructured dancing. Exercise really, really helps with that, just for that particular. I'm taking the skills out of this, but just for production of dopamine, exercise is really helpful, especially if the children are medicated, right? So like this, they really need some of those boosts. Okay, so movement and regulation, the brain-body connection. Okay, so as I was talking to you about this right now, it's that exercise enhances dopamine production. So we need all this movement. And then if you actually start structuring exercise, so giving their kids the opportunity not just to move their bodies, but also move their bodies with intention. So, for example, learning a yoga routine or some kind of a dance, or giving them an opportunity to do some kind of like a ninja obstacle course, things of that sort. Now also not just giving them dopamine, but also start working on some of those skill building things. So sensory input for them is very important. Proprioceptive input helps them understand where their body is in space. So a lot of compression, heavy work, animal walks, opportunities for, to do a lot of hanging, a lot of pulling, a lot of pushing, things that make them understand where the body is in space, giving them, hugs, having them do, activities such as tug of war, or playground stuff where they can climb nets or do rock climbing walls, things of that sort is really very, very helpful for them to feel regulated. Vestibular system is very important as well for kids with ADHD. They need the vestibular input. So when you provide vestibular input on the playground, whether it's on the swing, like a regular swing, you want to make sure that it has rhythm and timing, right? Because we want to give them that input, that linear input, in a way that is going to help them regulate their bodies. Now, rotary input is really, really helpful as well. However, rotary input can be overwhelming, especially if the children are more sensitive to vestibular input. Intense rotary input can make them feel uncomfortable, can make them feel nauseous, can make them feel disoriented. So we have to be a little cautious with that. But if they do tolerate it, especially kids that usually really enjoy that are the kids that can't stand their body like still at all. They can't stay still for an extended period of time. These are the kids that are also runners. If they're always running, that means that the linear input is usually not enough for them, and they would benefit from rotary input to support them. Because these are the kids that are already trying very hard to stimulate their vestibular system, but they're just not registering that information, and they're looking for more intensity. So for those kids, try giving them some rotation, either on a spinning board, or if you have a swing, try a swing with a rotator. Another thing is interoception. Because these kids spend a lot of times in their heads, they're also not tuning into their bodies. So these are the kids that you're going to hear a lot of I don't knows. Like, are you hungry? I don't know. Are you thirsty? I don't know. Does that hurt? Yeah, I don't know, maybe. And like meanwhile they like fell off like a swing and have like a scrape and things of that sort. So these are the kids that are not always tuned in into what their body is telling them. And that's because the insula can be impacted as well from the neurological standpoint. So they have a little bit more of a hard time with that registration. So giving them some interoceptive training is very, very helpful to make them more aware of what their body is requiring of them and what is happening to them as well intrinsically, right, internally. So a lot of times we do like social thinking curriculum and very cognitive types of games, which is also helpful. But before that, we should really consider interoceptive training. So what we're looking for is improved attention, and we're looking for improved focus. And that again, like one of the ways that besides compensating, right, like from the environmental standpoint, one way of thinking about improving attention and focus is thinking about those oculomotor skills. Looking at how it is that the kids are scanning their environment, how are they using their eyes, how are they using their eyes, hands, and feet, and do they have the ability to use that in a coordinated manner, or are they struggling with that? And a lot of times you will see that these kids are looking up while they are trying to catch a ball, and the ball is flying in their face, and they're like completely somewhere else because their eyes and hands are not working very well together. Okay, now rhythmic movement is also really, really helpful. Music is very, very, very important, and also very underused tool as well. Okay. There was actually some research that came out very recently about drums and how drums really help to manage symptoms of kids with ADHD and adults as well, for that matter. So when we're thinking about rhythmic, rhythm, that's a very cerebellum type of input. Rhythm and timing is very important. So one thing we could think about is obviously, drums, right? Like you have kids take drumming lessons, right? Or teach them how to drum. But, that can be very headache producing for those around them. When I told my daughter that maybe she should do drums, she looked at me and she's like, yeah, you know what? That's also going to be a really great anger management tool, Mom. So and then I said, oh, maybe not. Maybe we'll do that in a garage somewhere one day. Just because the amount of intensity that they're going to use is going to be overwhelming. But there are other ways of giving them that rhythm and that rhythm and timing in a different manner. So one thing that we could do is a metronome. And there's apps that we can get on our phones that could be very helpful for that. And those also, like, they think they sell like little metronomes on Amazon for maybe like $10. And when you're treating, if you put in those metronomes, it gives the child the ability to kind of like move with that kind of rhythm and timing, and that really is very helpful and very regulating for them. There is an app called Focus at Will, and it was designed specifically for people with ADHD, and it has different rhythms and tempos attached to it. So they have, and it's like techno-like music, I guess, or like electronic music that has very specific beats. And there's some that facilitate more calm, serene kind of feeling, but others also facilitate some movement and some activity. And depending on what a child may need at what particular moment in time, you can use those tracks to support them. So it could be, if you are trying to calm a child down from being overly excited by being outside and being on a playground, and just trying to get them to kind of settle down a bit, then you may choose something that's more serene and more calming. Alternatively, if it's morning and you need to get out of the house, and there's a lot of spacing out going on and difficulties with attention, then maybe putting on something a little bit more like Tool-like, which they do have an option. It's like a very intense techno Tool experience, and that facilitates more activity and movement and speed. So it's a nice tool to help with transitions, especially if a child is hyper-focused or is doing kind of boring things and needs additional input. One thing that I use in the practice is safe and sound protocol to help with self-regulation and auditory processing. If you guys don't know about SSP, it helps the activation of parasympathetic nervous system. It was designed by Stephen Porges, and it's very well known and very well used in with trauma, but I use it not just with trauma kids, but also with kids with ADHD, just to help them a little bit with more self-regulation, with more calming their neurological system down, as well as engagement. And I have parents that reported to me that this was very, very helpful for their kids, especially right before, transition to dinner time and then transitioning to bed. Like during that particular moments, that half an hour of listening is really, really helpful. The other tool is ILS, Integrating Listening System, and that was developed by Rob Minson, and that's filtered music. Both of these systems use filtered music, but ILS has different programs for different things, and they actually have a focus and concentration program specifically for kids that struggle with attention. The benefit of it is that it's filtered music. It has the movement component in it. It has so it's quite comprehensive in how it approaches all the programs, but the downside of it is that it's long. So, for example, the sensory regulation program of ILS is 60 sessions. So that's 60 hours of listening. And the attention and concentration program is 40 hours of listening. So that's a really big commitment. It also requires specialized equipment. It requires consistency. So it's a little bit more demanding and it can be harder to do this in a school setting, but if the parents are interested and are committed, then I have very good stories of success with it being done at home. Okay, Alison, I'm going to check in if there's questions because I feel like I just gave a lot of information, so I don't know.
Yeah, so we have one question that came in is what's the name of the app that offers options for serene rhythm?
Focus at will.
I'm sorry, say that one more time.
Sorry, Focus at will. This happens to me right about this time when I start losing my voice. So I will send this out, but it's literally focus, and there's an @ sign, and it's will, WILL.
Perfect, thank you. I think that's the only question we have so far.
Okay. All right. So before I touch on the medication, I wanted to also talk a little bit about the executive function. So one thing is that kids with ADHD really struggle with is working memory. And working memory is like this, it's very tricky, right? Because working memory requires you to really understand, remember the quantity of information has to be retained. It has to be retained for a certain length of time, and it's also very susceptible to distractions. So, but it's the most important thing that we have in academics. So, or even like in daily life, right? Like I will send my daughter upstairs and say, hey, can you bring your jacket and, an umbrella from your room? And then she'll come back with like, why did you send me up there again? Like that working memory piece is really hard, and especially when we're just talking to the kids. So one of the really big things with kids with ADHD is giving them not just one way to support their working memory. So everything that you say, try to also have visuals for it. Routines are really best when they are done with not just expectations of habit forming, because you have to remember that it's really hard for kids with ADHD to form habits. It takes a lot longer to do it. But when they have reinforcement of visual checklists, of pictures, because you have to remember roughly 80% of your brain is dedicated to vision. So the more pictorial reminders that you have in addition to auditory reminders, that the more success you're going to have with working memory tasks. So if you're working in the classroom, make sure that you don't just give directions verbally, but you also have them written down, and then there is a demonstration perhaps of how to get the thing completed. Should you have a hands-on task, there should be breakdown of things into multiple steps. and it should be, a child should be able to repeat back to you what it is that you wanted them to do. Don't just think just because you said it that it's just that they now know it. You have to be able to not just expect that they remembered, but actually question them and see if they remembered. So working memory is really tricky, and again, it's not because they want to upset you or they want, they're ignoring you. It is because for kids with ADHD, it's like having a mental whiteboard, and you putting like, and then things are written in disappearing ink on it, right? So they already have like a small window, that working memory is smaller, and now that the disappearing ink, so that you said something, and then because they're so easily distracted, those instructions just kind of disappear for them. Okay, so ADHD medications, right? So there is really no cure for ADHD. If anybody tells you that there is, walk away, they're not your people. Okay, this is all about symptom management, and that includes medication as well. Medication is very helpful when it comes to symptom management, especially when it comes to focus and attention. Um, there's definitely different like dosages, so different dosages will have different impact, as well as different medication. And I'm not a pharmacist, and this is not my area of expertise, but I will just touch base on the pros and the cons of this, because I've seen this in practice, and I've also understand the both sides of the coin, right? So it can improve the daily functioning, especially when it comes to school, right? So if you have decrease in impulsivity and increase in attention, that means that the child is able to focus better, retain information better, and really learn a little bit easier. But medication themselves is not going to teach a child a skill. They're not going to teach a child how to do something. It just gives them an opportunity to learn a skill easier. But it's not just because your kid pops, or a child like takes Adderall or takes Ritalin or whatever it is that they are taking, it doesn't automatically mean that now they have the skills to complete the activities of daily living you want your 10-year-old to complete, when it's just not, it's not the same. Symptom management and skill acquisition is not the same. Okay, so this is why even if a child is on medication, they still need skilled people to teach them how to do things, so they can then carry that over. Okay, the challenges with medication is that they have side effects, and for some kids, the side effects are like losing appetite, to losing weight, losing affect. I see kids that, when they're unmedicated, they're very, their affect is just so much lighter and brighter, and they're exuberant and they're energetic. But when they're on meds, then it's like significantly dulled. And a lot of times parents will say like, oh, they're so much easier to manage, but I feel like this is just kind of like not who my kid is. So thinking about, and statistically from all areas of research, meds are the best way to manage the symptoms of impulsivity and inattention. But not all parents are happy with the side effects of them. And also in our current system, there's a lot of shortages of medication. And when there is shortages of meds, if you don't have other ways to kind of help and understand what's going on, then it's harder to support your children. Okay. So another common thing, there's medication and there's counseling, right? So those are the two things that are typically, when we think about ADHD, that's what typically gets prescribed by pediatricians. So, and traditional therapy doesn't always work. I think the intention is great. I think the cognitive strategies are really amazing. But with our kids who can't sit still, who don't feel their bodies very well, who can't recall those strategies at the moment that they need them, talk therapy is not always effective, right? So, and I'll have parents who'll come in and tell me, well, listen, he's been in counseling and we've been like working with a psychologist for 2-3 years now, but there doesn't seem to be any any movement when it comes to impulse control, when it comes to tantruming and dealing with frustrations. And that is because those underlying neurological processes are not addressed. When we're doing talk therapy, we're really talking to the frontal cortex. But if that frontal cortex is really not that well developed and is struggling, guess what happens at the time when your child is dysregulated, or the child is dysregulated, or is having a big feelings and big reactions? They're not thinking about, pausing, right? They're not thinking about stopping. They're not thinking about taking those 10 deep breaths, before reacting. That kind of goes away because they're not accessing their frontal cortex. And then when it comes to triggers, right, that requires to have interception. You have to understand your internal triggers. But if you can't tune in to yourself internally, then it's very hard to understand what is going on with you. There's very limited amount of insight, and then all of a sudden you just have these big reactions, right? And traditional therapy with a psychologist isn't necessarily going to be able to help with that in as quickly as OTs could, right? Like, we have a little bit more awareness of interception and self-regulation and things of that sort. While counselors and psychologists are very, very skilled in providing strategies and building awareness. But I think it's sometimes our kids are just not ready for that right away. Okay, so one thing, whoops, sorry, you guys. Okay. Bear with me for 1 second. Okay. All right. Okay. So one thing that we don't always use but should also consider is additional things that are being used now a lot more with even general population, right? So mindfulness techniques, right? So that's teaching the children breath work, not just like what we would typically do, but also there's like apps that we can use to help them practice breath work. One of them is called Breath, just as easy as that. And that helps them to see, and also helps them to monitor their heart rate. So what I've been doing with kids is I've been teaching them box breathing. So you take in, you hold for 4, you breathe in for 4, you hold for 4, exhale for 4, hold for 4. So we would like draw a box, and then we just count, and that's kind of how we do it as part of our interception training. And what we do is that I'll have them exercise before, and I'll have them check their heart rate and see that their heart rate is like in their 80s or whatever. And then we'll do this box breathing technique, and then we'll check our heart rate, and the heart rate is lower, and this is how they know. And this is very tangible, it's very concrete, and it's very interesting because it's all about them, and they know how this works for them and their bodies, and it's really very, very helpful to them. Then so that's, and also yoga. Like, yoga is such a great tool, and it's not for every kid, and every kid needs a certain speed of yoga. So some kids really like it as long as you keep it moving fast, and if you gamify it. Kids with ADHD love games. Anything gamey, they will go for it. So if you gamify yoga, it's so great for them, especially if you can get a friend to do it with them, if there's an opportunity for that connection. That's really that's been successful in my practice. The neurofeedback device that I like to use is called Mendy. It's fairly inexpensive. I mean, it's like $270. And if it works in sessions with the kids, then I will ask the parent to see if they can purchase it for home to do it. But basically, it's a band that you put on your head. It's very light. It's not noxious, and the concept is gamified as well. So, and Mindy, what it does, it measures oxygenated blood flow. So, so the more you think about, so there's a ball, you're looking at a screen, and there's a ball, and the more blood flow you have to your frontal cortex, the higher that ball goes up. So the goal is to keep that ball as high up as you can for as long as you can without letting it drop. And it's interesting because kids get very, very motivated, and I don't do it for a very long time. I do it for like 5 minutes, 7 minutes, but the easier it gets for them to do it, the more dopamine they produce, the more it becomes very regular, like reinforcing for them, the more they want to do it. And that is one way that we can also help them train their brain. And again, these are techniques to help the kids that are, either impacted by medication shortage, or are not necessarily wanting, their parents are not necessarily wanting them to do these, to take meds. Another approach is sensory-based interventions, which I already kind of talked about, which is a lot of proprioceptive, vestibular work combined with some tactile stuff, a lot of resistive activities, a lot of movement-based activities. For outside sports, I don't always recommend team sports for ADHD kiddos, because I find that if they don't understand their bodies very well and don't understand how to move their bodies in space, it can be hard for them to negotiate other people's bodies as well. So what we try to do instead is really think about what kind of sports that are more individualized, that will give them the amount of input that they need, without getting them to be overwhelmed or excessively challenged and wanting them to quit. So some things that I recommend are swimming, rock climbing, ninja courses. They're very simple. Circus. I love circus. So circus is great because it's non-competitive, it's a lot of vestibular proprioceptive input, and it's a lot of fun, and it also has a lot of creativity in it, and kids get a workout, but there's not of that kind of like, competitiveness, what if I didn't do this correctly feeling that's attached to that, and that really builds confidence in kids. Okay, so one thing that I'm very big on is the collaboration between the parents and the providers, as well as teachers. I'm currently, starting on April 28th, I'm going to be running a parent coaching group, strength-based approach to parenting children with ADHD. And the reason that I do that is because I find that a lot of times parents don't really understand neurologically what goes on with their kids, how their brains are different. The parents get very frustrated. There's a lot of challenges with getting the kids to do the things that the parents want them to do. There's challenges with routines, transitions, things of that sort. And it's important for parents to be educated as to how it is to support their kids at home, because yes, we as therapists are great. We see these kids, 1 hour, whatever, 30 minutes, whatever it is that we see them once a week, but parents have to live with them. So they have to have the tools in order to really support them. So in a school environment, it's important to give these kids an opportunity for movement breaks. And I know that like movement is like this, I guess, almost like an outdated concept, right? Like we are so focused on academics, we're so focused on achievement, but at the same time, for kids, in order for them to do well, they need to move. So, having them do playground breaks, or, having them be assistants to teachers, or chair monitors, or whiteboard monitors, or have them be librarians where they have to carry books to the library or from the library. Any way that we can support and give them some kind of movement breaks is really, really helpful. Visual environments. So Our classrooms tend to be busy. I was recently doing a presentation in a Montessori school, and they have the most loveliest teachers. They're such a nice group of people, but when you walk into the classroom, everything is open, much like this picture here. If you see everything, all the cubbies are open, everything is kind of exposed. And for kids that are not isolating their vision and already having trouble with visual scanning and visual distractibility, having these many things and these many colors and these many posters in the classroom is really not supporting their neurology. It's very, very hard for them. So finding environments, or even like throwing covers or sheets, sometimes I know like certain classroom models really do want you to have a lot of exposure to all the things that are available in the classroom. But if you can just throw some sheets down, or have like a corner that's not as visually stimulating, or bins that are not clear but maybe like a singular colored bin with like a label, that may be a lot easier for a lot of kids to pay attention to, not just kids with attention deficit disorder. So auditory supports, like I was saying before, music makes a difference. So for some kids, if the environment is very busy, an auditory support can be something that dampens that noise, right? So for other kids, it can be if they have low arousal levels, if they have trouble with transition, they may need something more uppity, like a jazz song or a techno, electronic music type of thing. Or if they need to mellow out and they're coming back from lunch and break or a trip, they may need something like Mozart or something very calming to help them. Time perception is distorted. Time perception is very distorted in people with ADHD. So giving them visual timers, which time timers that I think you guys know about, but there's also the opportunities for sand clocks that can be very calming as well. And also, if you take an analog clock and you mark it up as to like, okay, we now have like 10, 20 minutes or whatever time you want them to be, and just putting a mark on that, it's a much better strategy than just saying, okay, we're going to be done in 10 minutes. 10 minutes is very hypothetical. Time is very hypothetical in the brains of kids and even adults with ADHD. Time management is very tough for them. Also, like, how we have our Apple Watches and our Fitbits, and we just look at a time, and and then next time we look at a time, it's a different number. That's not so great for people with ADHD. That's because they don't feel time as well as we do. So the analog clock, actually, they see the time pass versus looking at a clock, not really feeling the time very well, and then just see the numbers change. Okay. So again, we want to think about different seating arrangements for our kiddos in the classrooms. We want to think about alternative seating options. So some kids do really well with cube chairs. Some kids do really well with bean bags. Other kids need wobble. I don't know if you guys know about bouncy bands. They have those really cool wobbles on their that you can attach to the legs of the chair, which I use in the school that I work in, and kids love that. It's called the Wiggle Wobble Chair Feet. Allison probably has a picture of that.
They're the wobble chair feet. Yeah.
You know how much I love those. um, some kids that I also that need movement, they use those like really nice little chairs that are just one-legged chair, and they give them a little bit of a wobble. So some kids do really well in rocking chairs. So I have kids that really need both the containment of a cube, but also the movement of the like the wobble things. So they really do well in those rocking chairs. Okay, giving kids structured movement breaks. I know that teachers don't necessarily like that because they have hard time. I often hear that, okay, well, after they move, they just get so rallied up, and it's hard to get them down, right? And get them back to do what they were supposed to do. So, but if you give them nice structured movement breaks, like if you pull out some activities from brain gym, or if you have them do chair push-ups or some kind of like heavy work activities, that can be very, very helpful. Uh, Project-based learning or kinesthetic learning is also really works really well for kids with ADHD. They really work best when they can understand and reinforce knowledge, not just from auditory and visual, but also from kinesthetic experiences. So this is why science, when it's done not just hypothetically, but actually through experiments or engineering type of classes, or even math. I think Beast Academy, though it's not typically used in school, but it is used a lot of times outside of school for learning. That's a really they have both all, they kind of take the kids through all the steps, and they start with kinesthetic exposure. So they start with cubes, and they start with a lot of tactile data before they give you like straight to worksheets. And that works really well for kids with ADHD. So one thing that I also know that we struggle with is getting, sometimes if the child is very involved in an activity, getting their attention can be hard. So one, and this is not part of this slide, but I did want to bring it up, is that when the kid is not responding to you when you're calling their name, I hear that a lot. I'm like, oh no, they just don't hear me. And I hear that from the teachers. I have to yell because this child is just not responding. But instead of yelling, one way is to get this child's attention is to give him a tactile cue. So coming up and putting your hand on their shoulder and then saying their name works better than just saying their name without that particular cue. So we want to make sure that we give step-by-step instructions as much as possible. So we want to, we want to break down a complex steps. We want to give them in short directives, short, concrete, simple, preferably with a visual reinforcer. You want to use very simple language, concrete language, not hypothetical language. And a lot of times we tend to speak a lot to our kids. Instead of just speaking, also let's ask them questions. That's the best way first to understand whether information was internalized and comprehended, is not but just by us talking, but also by asking them, like, what do you think you need to do next? What do you think is going to be the next step? What makes sense for you, to do after this particular, task? So we all know predictable routines are the best routines. If the habits formations are hard, we want to make sure that we have as much predictability throughout the day as possible. So as you see, like, what I like about this particular picture is that we have both the very clean background and a nice like label with a picture. Label and a picture, so the kids know, and it's the pictures of the kids of what they're doing rather than just a random picture, so they kind of can relate to the image, understand what is happening next, and really be part of this routine rather than being imposed, this routine being imposed on them. They now feel like they're part of this, so it integrates them. When we're talking about older kids, checklists are great if they're not too long. So think about the 3 or 4 most important things you want your kid to do, or a child to do in a day, or at a particular time of day, and focus on those things. I think checklists can be really overwhelming, especially if you don't get to complete everything on a checklist. It's hard to feel successful. So when we create these checklists for kids, let's not just, let's think about information that isn't just all information that they have to do, but also information that is both important and urgent, or important but may not be urgent, but it still has to be completed, right? So we have to prioritize what it is that we really want these kids to focus on so they can feel successful as well. I kind of already touched upon timers that and different types of timers, so I'm not going to take any more time on that. And then it's the first then strategy. So for a lot of kids, because they get lost in their thoughts, we want to make sure that they understand that there is a first step and then there's a next step, or we can use first, next, or first, then, whatever language that you're comfortable with is fine, but it should be a concrete steps. And that's how we are going to that helps with compliance in terms of if we want our children to do something, and then like first we brush our teeth, then we put on socks, or whatever it is that you guys that needs to be completed. But that's how we sequence it. That helps with task completion. When in the classroom, we want to be thinking about what type of kid needs what. So, for example, if a child gets really very easily overwhelmed, we don't necessarily want to position them in the center of the room. We want to make sure that they have a space where they feel kind of cozy and comfortable with. And I know that doesn't always sound good, but sometimes corners are like the best spots for these kids because it feels very embracing and also comfortable for them. You want to maybe stay away from like windows because that promotes distractions, right? They kind of stare into the windows a lot. Or if there's an area where there's a lot of movement and people coming in and out, or if in a circle time, maybe putting the child with ADHD in the middle of a circle, is maybe not the best strategy. Try to maybe either next to the teacher or in a corner, or if there's an opportunity for like some kind of like a rocking chair or a sit-in chair, that like a cube chair, that would be very helpful. Sometimes either in headphones or white noise machines can be really helpful, especially if you want the child to concentrate for specific assignments, tasks, maybe like writing essays or something that is specifically more performance-based and can be challenging. I don't typically recommend overuse of headphones, but because it does impact auditory processing. But at times when you need your child to focus, they do come in pretty handy. Visual decluttering. So again, maintaining a cleaner. So less is more. With kids with ADHD, as much as we want to give them toys and as much as we want to entertain all our kids and have as many toys and tools as we possibly can, but for them, it's really less is more is really the way to go. Think about neutral colors, nothing too overwhelming, bland. As bland as can be. If we want them to kind of like have a more relaxed kind of environment, feeling a little bit more chill, we want to make sure that we have some pastel and neutral colors work really well. Quiet corners. If you do have an opportunity to make a quiet corner in the classroom, that's awesome. Even if it's like an IKEA tent, they have those $20 igloos, and those work great because the kids, it's almost like giving a child an opportunity to have like a womb space where they can go in and they can read their book and they can fidget, they can have their time out. You can put like a fidget box in there. It's very helpful, and it can help them self-regulate and organize themselves for other tasks. So in terms of we want to make sure, as I've mentioned before, that there's combined methods of instruction. We don't just want to talk to them. We want to give them hands-on activities, visual supports, and verbal instruction. We want them to be active participants, so worksheets, for example, don't always work well because It's too much on a page a lot of the times. They don't know where to start. Things become overwhelming. But what does work well is more active participation, like role playing, improv, group discussions, project-based learning. Technology is great for some academic support. So, for example, for kids that really struggle with essays or producing written output, having them talk to an app like Otter, 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 and then have Otter record their thoughts, and then working with them on trying to see, okay, well, how do we get all this wonderful information that's in your head? Now that we have it typed up in front of us, maybe how do we actually take out what's relevant and what's not relevant and put that on paper? If that's if you guys do use paper and pencil in schools for essays. Audiobooks are great. There's also a lot of ways to use tools that are helpful with kids with ADHD for organizations. So they have what is it? What is that called? Goblin tools. I don't know if you guys heard of that, but it's really great to help kids. Like it's designed for kids specifically for ADHD, and it helps organize data. It helps you with judgment. It helps you predict time. It has a lot of things in it that really can support ADHD brains. It even creates recipes for you guys. I mean, AI is great. So for feedback, we want to make sure that we do give a lot of positive reinforcement. You want to focus on the process and not the outcome. Outcome-based praise is not very efficient. You want to, because outcomes can be great or they can not be great, and regardless of amount of effort you put in. So you always want to focus on praising the efforts and not so much praising the outcome. Also, when we do provide praise, make sure that you provide very, very concrete feedback. It's not good job. It's not well done. It's like, oh, I like the way you sat down and were able to read this book for 10 minutes without being distracted. That's specific praise, and that's how you want to reinforce behavior. So you want to do reward systems. Sometimes charts work, sometimes they don't. Sometimes stickers work, sometimes they don't. Depending on a child, you have to understand what it is that is actually rewarding to them. And because kids with ADHD like novelty, you may want to think about how to introduce that novel piece as part of your reward system. And also choice offering, giving them the opportunity to have some control over what's going on in their lives and what choices that they have, whether they, what kind of reinforcement they want to have, whether they want to go to the movies or if they want to go to a trampoline park or if they want a sticker or if they want to have extra 10 minutes on the playground. So you want to give them a little bit more of the opportunity to make a choice when there's a possibility to do that. Okay. So I think this is mostly for like 504s. We want to give them as much opportunities for understanding for assessment so we can really understand what it is that they know, as well as give them the opportunity to show us what they know through accommodations, right? So sometimes if they can't tell you what they know by written expression, give them oral presentations or projects, poster projects. My daughter loves poster projects because it gives her time as well as an opportunity to really understand the topic. We want to give them extra time on tests and quizzes, and the assessment format should have a little bit more flexibility in it. Okay. Again, parent-teacher collaboration is important. I can't stress that enough. The more you talk to the parents, the more teachers understand, the more we share resources, the more accommodations that work in the classroom or the accommodations that work at home can be carried over in between, the more consistency the child has, the more opportunities they will have for success. It will make a tremendous difference in terms of their confidence, their skill levels, as well as the experiences that everybody has across who works with them. Okay. So I think I've talked myself out of my voice at this point. So the key takeaways are that ADHD is a neurological condition, that OTs really have a very, very strong role here, and it should not be ignored. And collaboration is incredibly important, and all brains are not the same. Okay, so we have to look at the child, understand the child's profile, and approach to them as an individual, and understand what their brain really requires in order for intervention to be successful. Okay, Q&A. Here we go.
Here we go. Okay, so first question. Can you explain how to use the SSP protocol?
So SSP requires you to actually get certified. It's not something that you can just kind of plug in and go through. So MyUnite is the app and the company that does certifications for SSP. The training for it is about, I want to say, 6 hours. Roughly 6 or 7 hours. And what you do is that it takes you through entire understanding of what kind of music it is, how to use it, with what type of clients, when not to use it. So it's an entire process. It's really a great tool to have. I like the fact that you don't have to go anywhere. You can do the certification at home. And it's the way that it is just divided is that there's 3 components to it. So SSP has a SSP Connect, SSP Core, and SSP Balance. SSP Connect is basically a warm-up program for the kids that are getting used to wearing headphones, getting used to listening to music, so on and so forth. The Core program is the filtered program. And then the Balance program is more like a reinforcer of the Core program. And what I really like about it is that it's not very long. So each part of this SSP kind of components is 5 hours. You can repeat it if you need to. The strictest part is the core program. Both the Connect and the Balance program are a little bit more flexible and can be used in a less structured way. But if you really want to understand it and go into the details of it, you should really check out the website and get certified.
And a follow-up on that, do you know if CODAs can get certified to use SSP?
I believe anybody can, even parents can get certified.
Perfect. All right. Do you treat ocular motor skill deficits as an OT, or do you refer them to a developmental optometrist for vision therapy?
Both. So for the things that are connected to vestibular function, I will treat in therapy. So for example, if I see that a child is struggling with vestibular system and oculomotor system because they're so intertwined, I will work on those systems together. If I see that the vestibular system is improving but the oculomotor system isn't, I will refer them out to developmental optometry.
All right, a quick comment here. The disappearing ink analogy is incredibly eye-opening, so we like that. Thank you. The next question, can you spell the name of the biofeedback device that you described?
It's called Mendi, Mendi. I actually have a link for it, so I can send that over to Allison later.
Perfect. Okay. And what is the name of the neurofeedback device?
The name is called Mendi, Mendi. Is that the question?
Yeah, sorry, there's just a couple of those in there. All right. What is the name of the parent collaboration group you are launching on 4/28? How does a parent access it?
So it's called the Strength-Based Approach to Parenting Children with ADHD. I'm doing it through my practice. If you go on my website, www.kidlinktherapy.com, there'll be a landing page for it, as well as the more information on it. So you click it and fill out the form, and I will reach out to you. Well, to the parents or to you or whoever.
Perfect. And can you briefly explain the Otter app you mentioned?
The what?
The Otter app, the app that you're talking about?
Otter. So Otter is an app, and what it does is that it's a recording app. So for example, if I want to uh, think about a an essay or a topic and I just want to brainstorm it, right? But I'm having trouble writing, right? So I don't have like a mind map in front of me or anything of that sort. So I will use Utter and I'll just spew out whatever ideas that are coming to my head, I'll spew it out. But then what Utter gives me the opportunity to do is to review it, to edit it, to kind of to play with it. It now has also AI summaries. Everything is AI now, right? So they have all these kind of additions to it. But it was a really, and I'm sure the Otter is just the tool that I use, but I'm sure there's a lot more tools out there that are for the similar purposes. But what it does is that it gives you the opportunity to load information from your head onto something and then work with it to make it more cohesive, more coherent, and then transcribe it to a paper or an essay or whatever output that you needed to do to use for grade or for an assignment for whatever it is.
Okay. Do you think there is a link between ADHD and handwriting issues like dysgraphia? And do you
Yes.
think it is okay to, okay. And then the other part of that question is it okay to introduce technology in lieu of handwriting as young as first or second grade?
So I'm not for introducing technology into first and second graders. So fine motor skills are controlled by the cerebellum, as well as the oculomotor, as well as handwriting. That's all controlled by the cerebellum. Kids with ADHD don't have the same cerebellum function as typical developing children. So what you see a lot is that their handwriting is worse than kids that, neurotypical children. So as a result, if we give them technology and then we start with compensation, that we're not giving their cerebellum an opportunity to work out. Because writing is not just a ways of expression, and it's not just it's not just like required by school, but it's also an opportunity for our brain to have a motor learning experience. Okay, so when we are taking away those opportunities and not giving the kids a chance to practice those skills, then we're also taking away from them the opportunity to learn and enhance neuroplasticity. So I am not I think there's a room and ways to use technology. I just don't think that it needs to be persistent. I think if a child has to write a long essay or very demanding tasks, then technology should be utilized to help them. However, on daily basis, they should be practicing handwriting, especially when they're younger.
Okay. Do you have any advice on how to increase handwriting?
Yes, you do it through functional tasks. So I know handwriting without tears is a big thing, and it is very helpful in certain settings, and I use it myself as well. So um, I'm not taking anything away from that. But if you want a child to do writing, you have to make it personalized. So what are your kids' interests? If your child is interested in Pokemon, if they're interested in in journaling, if they're interested in drawing, if they're interested in making cartoons, or if they're interested in making those graphic novels, you encourage them to do those types of tasks, even if it's little, even if it's not like hours of writing, but you get them to do it, and slowly and surely it will build up a skill. And also vary the tasks you give them. Give them not just handwriting sheets for practice, but also vary what kind of challenges you give them. Crossword puzzles, Sudoku, have them write down lists that they want to create. Use creativity, use imagination as part of their assignments, not just everyday kind of like easily accessible, just copying information and data. That's very boring. And for kids with ADHD that like novelty, that's really not that fun for them. They will not comply.
All right. Maybe we can do one or two more questions quickly before we end here. Is ADHD differently expressed in ASD kids. She's given the example of a child who has many ADHD traits like creativity, poor focus, defiance, etc., but school not keen to send ASD kid for ADHD assessment.
There's an overlap for some of them, and there's also overlap in presentation. So for kids with ASD, a lot of times they can have ADHD symptomology, and in addition to also social skill challenges, right? So I currently see a child who has both ASD and ADHD, and he's really there's a lot of areas that overlap, and the way I treat is similar, except that I also really pay a lot more attention to their neurological profiling. So I really want to understand what their baseline neurology is doing. So from a sensory processing perspective, I really target a lot more of that than I do just cognitive skills. So I do a lot more motor planning. I do a lot more understanding of, what are their strengths in their neurology, what their weaknesses are. And the last thing I do, it's like the layer on a cake, is the last thing I do is more of like, social skills or handwriting or executive function skills. But before any of that, I really, really target their, sensory processing and neurological profiling.
All right, maybe we'll do one more question here. Can you describe the connection between emotional dysregulation and ADHD brain?
So emotional dysregulation is one of the first, from an executive executive function standpoint, as well as self-regulation standpoint. Emotional regulation is one of the first skills that the children should be obtaining. However, because ADHD brains are younger than your typical brains, that skill is delayed. So we're having these kiddos that are not very in tune with what's going on inside of them. They get very easily distracted. They're very easily overwhelmed. They can't understand necessarily intrinsically what their triggers are, and that what happens is they can't modulate. So they have these big, big, big reactions to little things, and they can't modulate those reactions very well. So one strategy is, again, you have to go back to their fundamental neurological profile and understand what are their triggers. Are they overwhelmed by their environment? Are they defensive? Are they seeking? And when they seek, do they get saturated quickly, and then they kind of like get overwhelmed because they're saturated? Like, we know kids that are very excited to play with friends and want many friends, but as soon as they're on this big play date or party, 5 minutes into it, they will have a meltdown, right? So we want to be able to differentiate and really understand what are these children's triggers are, and then make them aware, make their parents aware, and start building up skills around those.